Okay. Hello, good afternoon, Prof. Thame. Thank you for taking the time to meet with me and chat with me today. Can you start by telling us a little bit about yourselves, what you do, and why you do what you do?
Okay, well, I start off first by saying I'm the Dean of the Faculty of Medical Sciences on the Mona campus, but I'm also still affiliated with the Department of Child and Adolescent Health, where I'm one of the consultants who rotate in the special care nursery to look after our precious little ones.
So, can you tell us why you went into neonatology?
Um, I've always, well, first of all, I enjoy pediatrics. I've always liked pediatrics, and I've somehow always gravitated towards the newborn. I also have done quite a bit of research which sort of delves into perinatology, looking at maternal nutrition and how her nutrition affects the baby, affects the baby's outcome, baby size, and I guess they just go hand in hand. So looking at perinatally what they do, I've also been trained in fetal ultrasounds and following growth of fetuses. So I guess naturally I would just continue into neonatology and looking after them once they are born.
Right. So, can you tell us how long you've worked in neonatology?
Wow, that is taking us back some time. So after I graduated, I actually went to the tropical metabolism research unit at that time, and that's where I did a PhD. But while doing that, since 1992, I've been engaged with the Department of Child and Adolescent Health, where I worked in neonatology or looking after the newborns. So it's really from 1992 that I've been in the nursery.
Wow. Okay. This was news to me, Prof. Thanks for sharing that. So tell us what your hopes and dreams are for the neonatal unit.
I think the main thing is to see a unit, and I'll take it from two parts, both from the staff and from the equipment. So let's take the equipment, which to me is probably the easier one. I'd like to see a unit that is well equipped, where we have all the necessary resources to look after our very tiny ones. And I've seen that over time. I'll tell you that we have done certainly better and better. So we're seeing much more survivors among our certainly less than 1,000 grammars. We have 600 grammars that have survived, and I would say that the smallest one is a 540 gram infant who is now 30 odd years old, who survived. She probably might have been one in a large number, but it is possible. But I have seen where we have improved over time in terms of having our smaller ones survive. But with that, we do need equipment. We do need to concentrate more and more on nutrition. And I'd love to see a properly functioning TPN unit that really a nutrition unit that looks after the nutrition of our small, very tiny ones. Because to me, without nutrition, you're fighting a losing battle. So I also would like to see where we have, I'm not struggling and fighting to get a ventilator because I'm juggling between 3 persons who may need a ventilator, 3 children who may need a ventilator, but having access to all equipment, incubators, something as simple as incubators. Sometimes we are making makeshift with an incubator because they're not working, and I have so many kids on the nursery of which I don't have the equipment of which to really monitor these children. Monitors, making sure that every child has a monitor, every child has an IV pump, and I'm not sharing equipment between. So the equipment, I think I would love to see the equipment on our unit improved, and then the hard one is the staff. As we train our staff and we get comfortable with our staff and we have excellent nurses, we unfortunately lose them because they're looking for greener pastures, they're looking for survival for themselves, and therefore we lose them. But we have had some extremely good nurses that we've lost to North America, to the rest of the Caribbean. I've gone to the rest of the Caribbean and seen our nurses there, but financially it is difficult for them to survive with what they earn, and I can understand, but it pains my heart when we have gotten so close to some of these nurses who we know are excellent and we lose them.
Yes. So some very challenging issues to deal with.
Yes.
How do you see the partnership with the Caring for Miracles Foundation helping to address some of these?
Well, as we've had partnerships before, I think in getting equipment is one big way, and I've seen where we've had partnerships with the Creamy Foundation, which have really helped in getting equipment. We used to have many years ago, long before you, Dr. Lewis, the Special Care Nursery Foundation, which used to have banquets, and that's where we got a lot of equipment. So a lot of things that we actually got on the nursery was from the funds that we got from this annual foundation, which really helped us tremendously. Many persons on that foundation now, unfortunately, have transitioned. Those that are there now are too old to continue. And therefore, if you could take the place of such a foundation and step into those huge shoes that they had, I could see how we could really improve, especially, as I said, not the staff, but certainly the equipment that we have on our nursery, which, as you know, is continually having to upgrade and to replace.
Right. Okay, awesome. Thank you, Prof. I know you're a very busy lady, so I'm not going to take any more of your time. Thank you for sharing with us and making the time to chat with me today. Thank you.
It was my pleasure.